So, I mean, for me, a lot of advocacy is about telling a story, telling a narrative, and kind of weaving in data points, but also like those first like real world experiences and highlighting like this is an issue that's much more complicated than just somebody made some choice and something happened and now they're homeless. Like it is a cascading failure of systems where they weren't just failed once, they were failed multiple times at different levels of government and services and themselves and then family. Like it's a fully encompassing like failure of systems that lead somebody to be on the street. It is hard to tell that narrative and that story to people that have in their like humdrum of like going through the humdrum of life. Like they don't stop and think like, okay, this is all of the things that I benefit from by being housed that I take for granted. Just like accessing documents and knowing where your birth certificate is always. Like that is an easy thing for them to know.
Welcome to today's podcast. We're thrilled to be joined by two amazing individuals, Liz McQuillen, who's the Chief Policy Officer at Metro United Way, and George Eklund, Director of Education and Advocacy at the Coalition for the Homeless. Liz, George, thanks for joining us. Really appreciate it.
Glad to be here.
Looking forward to our chat. Right, where I'd love to just start with you talking about the roles that you have at your respective organizations, but also if you can just touch on kind of the passion and reasons why you do what you do. I think our listeners would really benefit from hearing about that. So Liz, we'll start with you.
Sure, I'm happy to. So my path to policy really started, I worked in local government at Metro Council for about 10 years. So really got a perspective of how some of the systems work, and then moved into sort of business advocacy, working for the chamber here. And so was able to get more experience in Frankfurt and really started interacting with Metro United Way, social service providers, because at the time the business community was COVID. And so they were really focusing on workforce barriers. And that's where I was really drawn to. So work in early childhood education and housing. And so about 3 years ago, I made the move over to Metro United Way. And so we really, we do a lot in our impact work programmatically and work with a lot of partners. But I get to support that work on the policy side. We always say that what policy has built, programming alone can't transform. And so it's really exciting to work on issues and actually make a little bit of headway, even if it is incremental, on these issues that really affect everybody. But when we focus on policy, you can have a bigger impact and really support all the good work that's also happening in community.
Thank you for that, George.
Yeah, so my journey to get into housing like really started back where I grew up. I grew up in East Kentucky, and there were a couple members of my church started some like nonprofit housing developers, Frontier Housing. And so it was kind of just this theme of like people working on housing was always around. At the same time, I would see like students that I went to school with living in like substandard housing conditions of like a single wide trailer with multi-generational families, in substandard units. And so it was just kind of like my worldview growing up, like seeing how easy and secure my housing was versus like classmates of mine. And then throughout my career, I always kind of fell back into housing work where I was doing outreach to people facing foreclosure during the foreclosure crisis. I did a lot of landlord-tenant organizing during college in Bowling Green at Western Kentucky University. I work for a nonprofit that does cross-country bike trips to raise money for affordable housing and do volunteer work along the way. And then, I found my way to the coalition where I became the Director of Education and Advocacy. And my role is really just to take data points from our members, from people that are experiencing homelessness, and try and apply that lens to the policy works that we're doing. And like Liz said, like we can't just do direct service and solve this issue. We got to think about upstream interventions of like, where are the systems failing people? Where are the gaps? Where are the cracks that people are falling in? And let's go plug those cracks so that we prevent the trauma and the lifelong like struggle that we put people through every year of just trying to stay housed and safe and stable, and finding that castle in our community that is their own.
Thank you for that, George. And I think the prevention side of this is so important. And later on in our conversation, Liz, I want to ask you to comment on an article that you wrote that related also to childcare and the importance of childcare in the state of Kentucky, because that does relate certainly to prevention, I think. Um, let's talk a little bit about, well, I mean, to your point about the importance of advocacy and education, George and Liz, you talked on policy. Why is it so difficult to get folks to kind of wrap their head around the challenges that we face? And what I mean by that is, for the short time that I spent at St. Vincent de Paul, it was just so glaringly obvious to me that, um, and I'll say it this way, that for folks that I would have thought may have had an understanding, didn't, and in some cases lacked a sense of empathy, and which made it more difficult to kind of have that conversation. Why is it so difficult to spread that awareness, to get folks to act? I mean, it would be nice if we didn't have to have advocacy and folks out there doing that, but we need you all to do that
Hmm.
because it is difficult and it is not necessarily easy to get people to wrap their heads around the facts, and there's so many myths, right? So what talk a little bit about the importance of that and creating that awareness. I use the word empathy,
Hmm.
um, because I think once you have that, I think it's a whole different view that you take. But talk to the importance of building awareness and raising awareness to get folks to actually respond. And I know, again, you guys spend so much time with legislators. It's so important for them to know, the truth, regardless of politics, because it's not, to me, it's not about politics. Empathy is not about politics. It's about being a human being. And so I think it's so important. So I'll stop there and just would love for you all to respond to that.
George, you want to go
Yeah, so
first?
yeah, I'll go first. So I mean, for me, a lot of advocacy is about telling a story, telling a narrative, and kind of weaving in data points, but also like those first like real world experiences, and highlighting like this is an issue that's much more complicated than just somebody made some choice and something happened and now they're homeless. Like it is a cascading failure of systems where they weren't just failed once, they were failed multiple times at different levels of government and services and themselves and then family. Like it's a fully encompassing like failure of systems that lead somebody to be on the street. It is hard to tell that narrative and that story to people that have in their like humdrum of like going through the humdrum of life, like they don't stop and think like, okay, this is all of the things that I benefit from by being housed that I take for granted. Um, just like accessing documents and knowing where your birth certificate is always. Like that is an easy thing for them to know. So I think that lack of empathy just comes from like the fact that everyone in our community is working, they're trying to like have a life, they're trying to have a good like relationship with their family, they're trying to do good at work, do good at school. That I don't think they ever have like the brain capacity, not to say that they just don't have the bandwidth to take it in to say like, okay, how did that person actually get there, and how have I avoided those systemic failures and benefited from the systems that we exist in. But I think that's part of it is like people, we've become desensitized to the issue. Like we accepted that like, well, somebody's always going to be camping under a bridge. People are always going to be
Mm.
flying a sign on the end of expressway. Um, and from there, like it just becomes this issue that it's too big to solve. Like we're never going to be able
Mhm.
to solve this. This is where we're at. So I think it's our challenge as advocates is like how do we take those like action inhibitors like despair and apathy and move to like action um like more action oriented things actually believing that we can solve this issue and that everyone has a role to play in solving this issue. So
Hmm.
it's hard. And it's, yeah, it's
Yeah.
like, it's what it also makes kind of a challenging, fun experience for us.
I think also you hit on it, George, but the myth that it's all personal responsibility, I think is something really hard for a lot of people to sort of move past, and that homelessness is the most visible failing of a much larger system, right? It's because we don't have adequate housing supply, and it's because wages haven't kept up with the cost of everything. And so it does feel overwhelming. But I also think, one of the things that we have to realize as advocates too is we are trying to get decision makers, policymakers to a yes for our policy solution, and they don't have to have the same reasons to get there as us, right? Um, and it might be from a purely economic development standpoint, or they're business owners downtown who don't want people sleeping on their doorstep, right? Whatever their yes is, we need to, I think what our job is to figure out, what is going to be, attractive to them about the policy solution. And I do think that that's where there has been some traction, especially locally, around solutions to homelessness and all the momentum that's happening right now with Home for Good and all the partners that are involved with that is people are getting to a yes, and it might not be because they believe everybody has the right to, the dignity of their own home, but for other reasons. And we can't be choosy about why they get to a yes, right?
Yeah, no, Liz, I love that, and I agree with that completely. And one of the things I remember, you know, uh, trying to build more of the story at St. Vincent de Paul for what we were doing there at our Shelby Park campus. The best thing that we could do was not write. I mean, the newsletter. I mean, Tony does a wonderful job with the newsletter. It tells stories. It does all that kind of stuff. But if we can get people on campus to walk around,
Hmm.
I mean, there wasn't. I mean, I bet I did in the time that I was there 150 tours. I mean, a lot. There wasn't one instance after those tours were over where someone said, "Holy crime! Wow, okay, I've seen something that I didn't
Yeah.
see before. I understand." And it was even legislators. Some of the folks that
Yeah.
were behind House Bill 5 came and visited. And when they left, it was like, wow, we didn't
Yeah.
realize,
I
right?
remember when that happened. Like
Right.
it was night and day. Like just them seeing like how much goes into what's going on at your campus, but also every other provider that's
Every other
happening
one.
every day.
Yeah. And I think
And that's,
that's to your
yeah,
point.
it's yeah.
Right.
And we got to
And
yeah.
oh, go ahead.
I think there's just a lot of value of like getting people proximate to the issue and proximate to the solutions. And that's what has to happen to like really change hearts and minds on a lot of this issue.
Well, and also being honest about the realities. I mean, you know, um, we're talking about, Liz, you were talking about, the whole notion of personal, and well, that individual must have done something wrong or didn't do something right or, whatever. It's their fault kind of thing. And in some cases, I mean, we all make decisions and choices and things and it impacts our life. But I have to say that, when you think about, the notion of when you think about the word poverty, um, there's relational poverty is real. And I know a lot of folks that have difficulty with addiction, but they're housed. You know, they have relationships they have, that are still in existence that can help them kind of still stay housed. And I think a lot of the folks I know that we served in the Shelby Park campus there, many of them were suffering from relational poverty and had the same exact issues as someone that was. So that notion that is just because of that is just it's a myth.
Right.
And so that's why I think empathy is so important to build. And maybe it's a dream, but I agree with you, Liz. Regardless of the reasons, if it's because of economic development, if it's because of tourism, if it's because of fine, let's all get together and try to do the work. Uh,
Right. And that's where we have to come like with evidence-based best practices, like that this is what works. It's going to solve your issue and it's going to get people like off the street into homeless or into housing, right? Like that's where we really have to make the case that there are best practices and we can implement them here. And I do think that, the other thing that is sometimes the problem does feel overwhelming when you talk about the whole system. But with things like Home for Good, we saw and George and the team at Coalition for the Homeless worked a lot with the folks in Milwaukee who implemented their system. And so I think the thing about Louisville that is also hopeful is that our problem is not so big that we can't solve it. We can actually solve this, right? It's not a huge increase in government spending or city resources. We can get our arms around this. And I think that's also motivating for people too.
Liz and Tony, let me just have one
You're good.
follow up to this because I think
Yep.
it's important to put this in context. And I love the fact that you're using the word hope because there is, right? You got to you keep moving forward. So, George, can you put some context around that in terms of some data around the latest uh, pit count?
Yeah, yeah.
What's going? What's Louisville's landscape look like in terms of homelessness?
Yeah, so in general, over the last 7 years, we have seen an increase in homelessness, both in shelter and on the street. We measure homelessness in two ways. So for listeners, and we do what is called the pit count, the point in time count. That is a one night count of how many people are in shelter, how many people are on the street, and it is a universally like comparable number to every other community in the country. We all have to do it. It's mandated by HUD. The other way that we count it here locally is what we call the annual like homeless census. So it is a unduplicated count of how many people are walking through our doors at shelter or for other services each year. So last year's pit count was right around 1,600 people. So that is about 500 people that are unsheltered, and that about 760 people that were in shelter in one night in January. I think this year was February, but it is just one night in the winter that is the count. Over the last year, typically we serve over 6,000 people that go into shelter, and that is an unduplicated number of like individual entries in and out of shelter. And then we serve over 10,000 people, our member agencies across the community. So St. Vincent de Paul, St. John, United Partners for Women and Children, like we serve over 10,000 people each year. So that might be some family that comes in one day and gets services and then we never see them. Or it might be somebody who's chronically homeless that we see multiple times over the course of the year there. The good news is that because of the investments that we did in American Rescue Plan dollars, we saw a decrease in the number of unsheltered people. So it's the lowest number that we've had since 2022. It's about a 17% decrease over last year's number. And so that to me shows that when we put money into bricks and sticks building housing options for people that are very low income, that are experiencing homelessness, and pair it with the services, like that is the result that we can get. It shows me that like when we actually focus on providing housing, like we can make a difference, and we can kind of turn this trend around.
Yeah, so I'd be curious. You kind of touched on it a little bit, and Liz, you can hit on it as well. In terms of the recently passed 2027 Louisville Metro budget, do you feel like we're in a good spot there that increase in money, increase in resources to homelessness, and helping those that are unhoused on kind of a good track?
Yeah, I think so. This would be a good time to talk about our Safe and Stable campaign too. So we talked about housing as a systems sort of level problem. And so a couple of years ago, George and I sort of put our heads together and said that, George has always done advocacy work at the local level around homeless services. But if we really want to tell the story holistically of everything from homeless services to affordable housing development and everything in between. And so that's really where the Safe and Stable Coalition came in. And so this year in the Metro budget, we were asking for several priorities, including homeless services, things like the Homeless Initiative Fund, that, go out as an RFP for those direct service providers, money for the Affordable Housing Trust Fund, which is our local tool to help incentivize and fill the gap for affordable housing developments. They do everything from permanent supportive housing to, 80% AMI, so like what is sometimes considered workforce housing. And then, this year we really focused a lot on those upstream interventions that sort of keep people safely housed where they are. So things like home repair, which the city sort of implemented a new centralized intake system. There was a study they did last year. There's about 29,000 low income households that average around, $17,000 in income annually. They need emergency critical repairs that, work out to be sometimes $11,000, $12,000. So they can afford those things on their own, but it's important to help them stay housed, to keep the home that they own in their family, to help them age in place safely, and to keep that house from falling into disrepair and becoming neighborhood blight. So that was a big one we added this year. And then also the Housing Stabilization Fund, which is really focusing on upstream intervention when we talk about families that their wages haven't kept up with the increased cost of housing, of childcare, of food, of transportation. And so for those families that are really paycheck to paycheck, they, they're good with their money, right? But they can stretch their dollars. But if you have an emergency happen and you don't have resources and you don't have support, you risk getting evicted, losing your job,
Yeah.
and just, needing a lot more interventions. And so we had a lot of success in a lot of areas of that. The Housing Stabilization Fund is new. It was the first time that they've invested general fund dollars into this. So it's going to go through the Office of Housing. But the way we talked about it was them putting out an RFP, so service providers could sort of come with their best ideas of how to help people. And then we also got some increased funding for that senior home repair. I can let George talk about the homeless services, but we fared pretty well there this year as well, especially compared with last year because we had so much. Where we still have, some room to improve around education and awareness is really around the trust fund because the investment year over year decreased. And it's such an important tool for Louisville, and so we have more work to do as an advocate community to really make that case to Metro Council.
Yeah, and we were able to secure, I think, $3.75 million for this homeless initiative fund and other like homeless service dollars. And those dollars are just really important because they fill the gaps that the federal government gives us in our funding streams. And so things like 24-hour shelter, things like outreach, things like other wraparound services that are so important to keeping people housed once we do get them off the street. Are
Can
important.
George,
Yeah,
real quick
yeah.
on that, sorry to cut it. To keep them off the streets, do you know the stats on when someone enters homelessness? How hard is it for them to exit out of homelessness?
I mean,
I'm just
I don't
curious.
have,
If you,
I mean, it's hard. Like
yeah,
once you're
it's not
out,
easy.
you think about everything that you need to get in. Like you have to be assessed. And then if you are not, the common assessment is a process where we just prioritize, it triages people into different programs that are most appropriate for them, but also prioritizes them. And frankly, it's based on how vulnerable they are on the street. So somebody with an amputation living on a bridge with cancer is going to be higher than somebody living in their car with a job. And it's just poor. And not able to have housing. I mean, but once they're out there and assessed, like caseworkers and your all staff, like they go through painstaking efforts to, one, we have to identify a place that they can afford with the voucher that we have in hand for them. We have to get their birth certificate. We have to get their ID. We have to then make sure that there's no other like screening criteria, like do they have an eviction on their record? Do they have past LG&E debt? Do they have other debts that are attached to their name? What charges do they have from past moments in their life? And with all of these things, every time that an agency puts in an application, that's $60 out of the pot, and they get rejected, and they have to do it again and again and again. So it is, and this is kind of speaks to like when somebody is housed, we take so much of that speed and efficiency in processes for granted. But when somebody is out on the street, it takes weeks, months to get into
Yeah.
housing. And once that voucher is given to somebody, a clock starts. And if you don't get housing within 90 days, you can get an extension in certain circumstances. But if you don't get housing in 90 days, you lose the voucher and it goes to the next person.
Hmm.
And it is, it's a rat race of trying to get people in, but it's hard and it takes time and energy by the case managers. And that's why we need those dollars coming from like different sources just to make it work. But what we do know also, like once we get them in, we have a 98% success rate of keeping people housed for more than
Yeah.
2 years. And that's Ural's numbers, that's other housing providers' numbers in the community. So we know that like once we get them in, we can keep them like stably housed for a long period of time to break that cycle of chronic homelessness and break that cycle of trauma that they're experiencing on the street.
Yeah, it was kind of interesting last fall when we, with all the SNAP challenges and food insecurity challenges, we sent out, to our supporters just the need for people to stock the shelves at our food pantry and open hand kitchen, and the overwhelming response of generosity from people was incredible.
Yeah.
And it speaks to our community, but you don't see that when you talk about getting people housed because of, like you said, the length and the time it takes. But food, it's tangible. But when you
Yeah.
talk about housing, it can be such an abstract concept for people.
Mhm.
I'm curious to hear, we've talked about a lot of different things, homelessness prevention and childcare and food insecurity and all these kind of complex things that come together to help or to cause homelessness. What is one thing that we're not talking about when it comes to homelessness that we should be talking about? Or said another way, what's one thing we're not asking that we should be when it comes to this topic?
Yeah, so I'm happy to start. I think, one of the things that I'm really excited about is that we now have new state data for Kentucky, and we've had it for Indiana. It's called ALICE, and I don't know if you all have heard of this. It's a lot of United Ways around the country use this, but it's an acronym that stands for Asset Limited Income Constrained Employed, and so it's really a way to we talk about poverty level, and sometimes we try to estimate. Obviously, poverty level is very low, but families who are struggling or who might still qualify for benefits, so like 185% of FPL. But Alice really encaptures families that are working, are right on the benefits cliff. They don't have, but they still really struggle to make ends meet. And so for the data that we have now for our Metro United Way region, which is 3 counties in southern Indiana and 4 in Kentucky, 39% of households are at the ALICE threshold or below. So that's all the way to poverty. And so when I think what is so just eye-opening about that number is that there are so many families, households that are struggling to make ends meet. They don't have any savings. They have debt or medical debt, and the system isn't built to help them. And so, and that those data points are all like a year and a half old after they aggregate it. And so we know that things are even worse right now, right? Gas prices are up, housing prices continue to rise. And so I think for policymakers, and we're excited to really have these conversations with policymakers about what their districts look like and the need in their district, because I think that there has been a long sort of standing assumption that if you're working, then you can make ends meet. And that is not the case. if you're a single parent household, if you have, even if you're a two-parent household or a multi-generational household, if you're working a low-wage job or two low-wage jobs, you still can't, what it's called an Alice survival budget. And so many households can't really afford that. And so I think it's really the realization that there are so many families that aren't visible, that maybe don't use services right now, but they have one emergency happen to them, and they might not be on the street, but they are now, their kids are making evento because they are, going from couch to couch. Or it just, once you sort of tumble into that level of vulnerability, it's harder and harder and harder to get people back to stability. So how can we focus on those upstream interventions that help people stay where they are, get more stable, because it's more cost effective to help them there, than when you all get clients to your all's door that are maybe chronically homeless and then have all of these other comorbidities that make it harder for them to reach stability.
Liz, talk about, and I know we've thrown around the word childcare in this conversation. My wife and I watch our granddaughter on Wednesdays and Thursdays and every other Friday.
Bless you. I'm sure that is much appreciated.
And it really helps our daughter and son-in-law. And they both have jobs.
Yeah.
But cost is prohibitive. I mean, it's unbelievable how expensive it is.
Yeah.
And so when we think about the investments that we make today, and you had even written an article on, I think it was entitled Childcare and Housing are Kentucky's Most Urgent Challenges. And you talk about this. And we're so much in the work of helping those that are homeless today, but to be able to plant those seeds today that clearly is going to benefit us 5, 10, 15 years, not just today in terms of parents being able to work, but also the children that are getting quality early childhood education. I know that Mayor Greenberg made an investment in this budget around that. I actually served, in full disclosure, I do serve on the board of Thrive by Five. And we're very grateful for that investment because we do believe that access to childcare is so important to the health of a community. But in that article, you said invest strategically on the front end.
Yeah.
What do you mean by that?
I mean, those are, and we have to do both, right? We have to invest in prevention, and you also have to invest in, programs and services that help people right now. But childcare is a space where it's economic development because you're helping families access work. It is kindergarten readiness. And so when a child has access to quality early childhood education, they enter kindergarten ready to learn. And then there's so much data about how they can be more successful students, and that helps them pay dividends for the rest of their life. And then there's a larger economic issue too, right? But to your point, childcare is so expensive. And I have 3 kids. The last one is in childcare right now. She's 3.5. But there was a 6-month period when all 3 of my kids were in childcare, and it was a struggle. We knew that was an expiration date. We knew our son was going to public preschool soon, and we just had to get past that date. But it is very prohibitive for families to have 2 kids in childcare like George has right now, and so it makes the decisions really hard for if you're a single parent household, you don't have a choice. You have to work, right? But if you're a 2-parent household, you think maybe I'll sit out of the workforce for a little bit while the kids are young. And a lot of families make that choice because that's what they want. But a lot of families also make that choice because they don't feel they have another choice. They don't have grandparents in town or access to sort of those friends and family that a lot of people have. And so it's really something. And then over the life of that, it just lowers that family's earning potential too. If you have a spouse or a partner sit out of the workforce for a while. So childcare, and so when we can increase access to quality, affordable childcare, it just improves outcomes for families. It makes them more economically stable. They don't have to use other social benefit programs. And then it also sets kids up for success. And, the data is clear around that. If you have access to high quality childcare, you are doing better in kindergarten, you are doing better at third grade literacy, you're doing better in life, right? There's a lot of longitudinal data around that. And so when you just think about what families are experiencing right now, childcare and housing just seem to really be the two most talked about things, and not just in our social services echo chamber, but also in the business community. It's why we partner with the chamber, the Kentucky Chamber, and One Louisville on a lot of childcare issues. The chamber actually led a collaborative of a lot of different stakeholders. We had a really big bill that passed this past session about increasing access and improving quality to childcare. And so I think, with all of this talk about affordability, it just seems like those are really the two things that families are struggling the most with right now.
Well, Liz
George, do you want to weigh in?
Yeah, George, you want to?
Yeah,
Do you want to weigh in on how expensive childcare is?
Yeah.
Yeah, I mean, right now I pay 3 mortgages in childcare,
Right.
Yeah.
and that's for 2 kids, and it is temporary. But I think about like all the families that have to rely on their social network to say,
Right.
"Hey, neighbor across the street is going to watch them on Monday. Oh, well, they're sick or they have to go to work. What am I going to do?" And because they don't have that stable like childcare that's affordable for them, they're going to miss work, meaning they're going to like be short on rent, or they're not going to pay their LG&E bill.
Mhm.
So it's this cascading of, we're not giving people good options, and we are criticizing them when they don't make the choices that we have the options
Right.
to make.
Mm-hmm.
And so it is all connected, and it's not just like one single issue, but it's this like bedrock stability pillars of like
Mm-hmm.
childcare, access to food, access to housing, access to healthcare, where if we don't have that, like the house will always be unstable, and they're always at risk of falling further down the continuum of housing.
Well, I think to Dave's point earlier about building empathy, that's how you build empathy, right? When you can think through your own situation, whether it's childcare or whatever kind of challenges you have at home, and that helps kind of build empathy for maybe some of the challenges of the folks that are unhoused.
Mm-hmm.
Well, yeah, and Tony, I mean, what I'm hearing, what I'm feeling, what I'm seeing in the community, and I want to commend you all. I mean, George and Liz, for how you all work together, and also with the Safe and Stable Housing for All Coalition. I mean, to see all those folks, there was the picture I saw with Habitat, and you're on, the 30 or 40 agencies and organizations that have signed on. When the community sees that kind of collaboration, it really has legitimacy. When folks are doing it on their own, it just gets questioned. Well, why aren't we all working together? Why are you working? And to see that collaboration, and also that sense of recognizing that we do have to invest. We have to do things today. We have to invest early. All these things. I feel like there's a coalescing around that reality that I maybe hadn't seen as much in the past. Am I just seeing it? Am I thinking that, or is that really, you guys feel that too?
No, I think it feels really special what we have. Like, we have such a robust community of advocates and housing providers that have really checked their egos in a lot of ways to say, hey, like, this is my slice of the pie, but we have a whole pie to like account for. And everyone like coming into that space, and we've really moved from like a space where everybody was making individual asks, the numbers weren't matching. Council was like, you all are the experts, but you don't even agree. Like, you got to figure out your house before you come to us. And that's a legitimate like critique for the advocacy community and the housing providers. So like, we all like got together and like having the hard conversations internally, so that when we go out into community and we have a consensus and agreement among all the providers, regardless of where they are in the housing continuum, that is synergy. That synergy is infectious. And I think we have started this parade, and we couldn't have done it without like the willing participants and the willing like members of the Safe and Stable Coalition. And I think it's a incredibly heartening and hopeful to see like small grassroots organizations in lockstep with large, more corporate like institutions in our community. Like that doesn't happen every day.
Mhm.
So it gives me a lot of hope where we're at right now.
It is.
George, oh, sorry, Liz, did you want to say something?
I was just going to say, it's been really exciting to work in that space. And David's 45 organizations that signed on this year.
45, sorry.
Oh, wow.
We had 40 last year and 45. But I think, and also we have partners like the Downtown Partnership and the Louisville Apartment Association who maybe this isn't their bread and butter, but they also recognize that housing is foundational to everything, to the community, to
Yeah.
those households, to our future as a city. And so to have buy-in from such a breadth of stakeholders, I think speaks to the importance of the issue. And it does, what we've heard feedback from council members is, I think that they recognize that too. That does give the ask some legitimacy because we have so many different organizations signing on too.
So, I'd be curious to close, George, and you can comment on this because on the pre-call you had mentioned, sometimes you'll get questions of, hey, how can I help, right? And we've got listeners that might be listening about the safe and stable housing, how they can jump in. And you had mentioned, folks coming to you and being like, hey, I want to give some suits and maybe I'll just bring it to someone on the streets. And you would recommend, no, how are some ways we can, our listeners can support, those in need?
Yeah, I think, and this speaks to, I mean, I think there's a couple of things. One, when people ask, like, can I just go to a camp and bring stuff? I usually say no, like, don't. Mostly because when people give me the example what they want to bring, it's usually the Goodwill box that's been sitting in their garage for a week or two or maybe 3 months, and they just want to move it. Um, that stuff we collect in our life has limited utility for somebody sleeping on the street. And so what may seem like a good idea of like, I'm going to take a suit to somebody on the street so they can get a job and they can like look more presentable. Um, the reality is the day it rains, that suit is ruined and it's trash. It is never going to get dry again and it's going to get moldy. It's going to become more refuse that is just um, going to lead to people complaining about an encampment, and then it's going to get cleared. I mean, what I would say is at a bare minimum, if you are driving through an intersection and you see somebody flying a sign, it costs no money. Just do a quick wave. Hey, I recognize you. Like, just act like you're in the country where you just wave to everyone. But also, if you want to get like involved, I think look around at the service providers that are here to support them. So I think we can give time, money, and power to this issue. So if you have time to donate and volunteer, like great organizations like St. John, St. Vincent de Paul, there are avenues for you to get involved that way. You can donate stuff to outreach organizations, like hard things that they actually need and will go to people. If you want to use your power, so going and talking to Metro Council members about the importance of housing and saying, hey, we need more 30% units, because if we aren't building units for this population, they literally have nowhere to go every day. And we have to focus our efforts to get those folks off the street through zoning reform, through approving developments, things like that. So I think those are the bare minimum. You can just wave and say, hey, if you donate, that's your choice. Or you can get more involved and proximate to organizations that you're familiar with that have a mission statement and a theory of change that aligns with yours, by giving them your time, money, and power. So
I'll also plug that we have advocacy days in Frankfurt. We have our Housing Advocacy Week locally now, as part of Safe and Stable. And so that's a really accessible way for people who aren't familiar sort of with those, with the state and local government. It's a really great way to sort of come and figure out how that all works, but in a way where we give you the tools and show you how to do it, and to support that work as well. And I mean, policymakers, legislators, council members really do value listening, but hearing from their constituents. So we'll send out a lot of action alerts and things like that, trying to make it quick and easy for people to engage. I also want to say that one of the things we focus on with Safe and Stable this year and going forward is really engaging the faith communities, because they have been such a powerful force in housing advocacy and solutions in Louisville. And so as we sort of, expand what we're talking about when it comes to housing policy and that whole continuum, really getting them engaged so they can understand it and talk about it, because they show up and they are really, really powerful advocates too.
Well, we'll make sure to link to the Safe and Stable webpage in the show notes. And again, Liz, George, thank you so much for your time. Thanks for being fierce advocates of those in need in our community. We appreciate it so much for your input today.
We appreciate you all. Thank you for having us.
Thank you so much. Great talking with you.